Hi, I'm Dr. Phillip Yoo at Orange County's premier sports, spine, and neuropathy laser concierge clinic centers. And today we're pretty much finishing up this young gentleman's bulging disc therapy. And before we start, I just want to get on the record of the progress that we've made. So could you tell Dr. Power basically how you were before and what progress you had after your laser therapies?
Sure. When I came in initially, my range of motion was limited to anything involving flexion was okay, turning and looking to the right was okay, but anything that was beyond the plane of my body, if I were to tilt my head up even a few degrees, it would be enough to send my arm shooting, numb, tingling. I almost had a constant numbing sensation between my index finger and thumb. Any motion to the left and any extension would aggravate that and make my arm just go numb.
Could you mimic remember before, just how much extension would ignite that?
Very little.
Just a centimeter, shoulder.
To the point that I actually had to walk around all day and sleep in such a way that my head was constantly flexed. Because if I even brought it into the same plane, my arm would go numb.
Yeah, now show the range of motion you got
now. So now I'm back to a regular posture where I can keep my head up, and then I have full extension again. It gradually sends my arm a little bit numb. We're not quite there yet, but it's dramatic.
Like when he first came in, I did the standard compression tests. That was okay, but I put him in extension and press down, and that would shoot like a lightning down his arm, and now he can take it, which is like night and day. And the MRI showed this huge bulge in the C5-6 on the left side, and I really had doubts that this was going to be that successful, and I'd have to send him to surgery. But now, after about 3 months with the laser decompression, I'm just amazed at the results. So,
and also just sitting here too, it used to be, like I said, a constant numb sensation. My thumb is now no longer numb, and I only have a small tip of my index finger is slightly numb right now. So that's also going away.
And he had this huge lump here of just contracted muscle and scar tissue, and basically his muscles here were trying to compensate for the weakness in the disc by contracting, and even that caused some myofascial syndromes down the arm. And you want to talk about that? How it's like smooth now? It's like,
yeah, I had never had a lump or a bulge or any type of deformity in the muscle prior to maybe 6 or 7 months ago, and then I noticed in conjunction with my neck going awry that I had this knot here. So when I came in, one of the techniques he's using with the graston, just running over it with the tools, that actually disappeared the quickest. Within a couple of months, that had gone from a huge literal bump that you would roll over to being
yeah. So what we've been doing, we've been using the graston technique to mechanically break up all that, the fascia and adhesions, and I'd argue it was also helping the disc to heal, because we're bringing in blood for circulation, and it's taking care of the inflammation there, and so I'm just kind of making sure that stays smooth. And it also warms the tissue up, so the laser will be even more effective by absorbing more of the photonic energy. And I combine it with a little, I call it the active release with the graston, so I'll show you how I do that. So why don't you elevate and decompress your scapula like that, and I go like that, and that kind of makes it a little more functional. Like actively release the tissue with the tools. And I got a little patented motion right here called the Jackie Chan. So, okay, down and up, and this will actively release the lower fibers of that trap. Yeah, right there. We always find a little catch right in there. Good. Okay, and then we get our high-powered laser. And we finish up by delivering photonic energy into the C5-6 disc space. And what that's, do you want to explain what that's exactly doing physiologically, Dr. Power?
All of the manual therapy that you perform
You could come over here.
breakdown. Yeah, we've broken down dysfunctional tissue. We've made it more functional, and now we're healing at the cellular level via photonic energy coming from a very high power therapeutic laser to accelerate the healing process 100-fold. And that's why we're able to, I'm sorry, your name?
Dijon.
Dijon are able to get these results so quickly. Is because we combine a little bit of the old and we mix it with a little bit of the new, and we get spectacular results without drugs or surgery.
So, and then when the laser is delivering the photonic energy to the damaged disc tissue, most of the damage will be to the outer annulus, or the outer wall of the disc where it's weakest. And what happens is that'll either crack, fissure, and then the disc material either bulges out or it actually herniates out. And what the laser does, it heals that damaged disc. It almost like it's welding the crack or fissures shut and preventing the nuclear material from oozing out and pressing on your nerves. So
It's recreating the strength of those fibers.
it's the same process, just like when your skin and bones absorb vitamin D3 from the sun, it makes your bones stronger. It's basically the same process. Okay? So thank you for watching Laser TV. This is Dr. Power. I'm Dr. Phil. Thank you for watching.